Thank you, Mr. Chairman. Good morning, ladies and gentlemen, and the people that are online attending this presentation. Yes, I will present the HAND project. That is a project we developed at the University of Bari. I have been the principal investigator, and the HAND project is the project for handwriting analysis against neuromuscular disease. I am the main researcher of the Intelligent System Lab at the Department of Computer Science of the University of Bari. And as a main topic, we work on pattern recognition, machine learning, artificial intelligence tools, and the cognition perception aspect of the intelligent system. Several fields of application are involved in our activity, like security and identity management, smart city, and so smart communities, and so on, and also e-health. This presentation deals with an e-health application, and the context is the context of neurodegenerative disease that, as you know very well, they affect areas of the brain that cause physical, cognitive, and behavioral decline. Of course, the main pathologic are dementia, Alzheimer, Parkinson, and so on. And it's quite interesting, this slide, because as you can see, as in the case for dementia, for instance, as there is the progression of dementia illness, we have that cognitive and physiological abilities go down. And of course, we need more and more sophisticated system in order to support the patient and also his family and his community. So far, we have systems that try to capture manifestations of such declines that are crucial for early diagnosis, differential diagnosis, and monitor of pathology of the disease. And indeed, we have a lot of tools that we use in order to face this kind of illness, like blood analysis, magnetic resonance image analysis, neurophysiological tests that are carried out with paper and pen. Of course, all this kind of approach suffers from human errors. In fact, we have several difficulties in staging the pathologies, evaluation that is often qualitative, and sometimes we have different experts that give very different also outputs concerning their analysis. The inability to analyze patterns that escape from a human eye, and of course the cost, because this is a very important aspect, since this kind of illness are very, very worldwide diffuse. In our work, we start from the consideration that manual writing is a discriminatory factor of the pathological state with respect to the state of health, and writing is in fact already an integral part of a standard neurophysiological test. So we can use handwriting in order to for the assessment of the illness. And when we have some pattern like this, we can see that we can face with the compromised hand coordination, difficulties in fine motor control, deficit in motor planning, and altered visual spatial capabilities. Okay, the HAND project has so some specific objectives that are mainly focused on the development of a computerized diagnosis system that is based on the handwriting analysis. And we want to support a very early diagnosis of pathology, but also it can be used for monitoring and the treatment of neurodegenerative disease. We have worked on two different dimensions. The test, we have carried out some software that can be used for testing the patient and to give very accurate information, but also on specific tools that we use for a more deep and relevant characterization of the subject. Concerning the acquisition protocol, it is a very complex and articulated aspect, but in general, there are two different stages. A preliminary stage in which we perform a very simple preliminary task, like just writing some a standard word on the writing a line that can be horizontal, vertical, or copy a square on the graphic tablet, that are very very simple test, and we use this test also to let the patient practical with the device, but also to extract some basic information about the characteristics of the writing activities of the writer. And then we have some tasks that are used to acquire different information, for instance, information related to the signature, the writing of standard test, the writing of a spontaneous sentence or also dictated sentence, the use of attentional matrices, and also other tests like the clock test, the copy of a completed check, copy pentagons or other geometric figures, and the copy of a spiral and contour tracing of a spiral shape. These are some of these tests have been developed in our laboratory, but they are part of a standard cognitive test, so they are very diffuse and well known from the scientific community working on this topic. The acquisition device is a standard tablet, and as you know, we can extract several information, like for instance the position information, and we can use this information to derive also dynamic characteristics of the writing, like velocity and acceleration and so on, but also pressure, timestamp, azimuth, altitude, and so on. So we have a very wide set of different features, and this is very important because in this way we can also capture some information that an expert cannot use. So in this sense, the use of automatic machine or a system or intelligent system starts from having the possibility to analyze a very wide set of different parameters and data. Of course, the acquisition of a sufficiently representative sample of healthy and sick population is necessary for the development of a predictive model. And for this aim, within the project, we have organized a well-defined staff of person and also a well-defined set of organization in order to acquire these samples. And in particular, we work on with the socio-sanitary assistance residents in the area of the city of the Bari. Of course, before each acquisition, as discussed before, each subject has been involved in signing informed consent according to the GDPR law, that is, as you know, the European Union law signed on May 25, 2018. We have organized a very simple software, and if we look a little bit in detail the software, we have some preliminary tests, and as you can see, we have a very simple acquisition form in which the writer is asked to write some standard words or to write some line and so on. And this is very important because in this way we also try to extract, according to a delta log normal model, as we will discuss after, some specific characteristics of the writer that we can use in further tests. A very central point of our test concerning the writing of a signature. As you know, a signature is a very personal act of writing, and it is based on a ballistic movement. This means that we have no control of the dynamic of writing in the while meaning we are writing. No? So this is the effect of a very personal movement. And in general, just giving a first look, but then we will see some more detailed analysis, we can see that the pathological subject in general do not respect any guidelines in the interface. And this suggests an impaired hand-eye coordination. Then we try to, we ask the writer to write some standard words. And as you can see, in general, a pathological subject tend not to scale up the size of the character according to the increased writing space, for instance. So there are some general conditions, very general conditions, that give us an idea about the difficulty in writing of a person. Another very interesting tools is the tools concerning attentional matrices. In general, the attentional matrices are matrices in which we ask the writer to choose and to search within the matrix for some specific pattern, for instance, a numeric element or also a character, something like this. And as you can see, we have a very different behavior between healthy people and sick people. In general, the healthy people exhibit a much more linear and methodical research strategy, whereas the sick people is more confused in looking on the matrix for essential parts. And we have also the possibility to evaluate to what extent the pen is contacting the tablet and when it is in the air. And this is a very discriminative characteristics between sick people and healthy persons. A similar test is performed when we ask to move from one point to another on the tablet. And in this case, also in this case, the difference between sick people and healthy people is very evident. Also, just by looking at the time in which the pen is on the tablet or is the tip of the pen is on the air. A very standard and maybe the most diffuse test for experts in the field is the clock drawing test. We ask the person to write a clock, and in this case, we have some information about cognitive characteristics of the patient and also on neuromuscular consideration. The sick show impaired executive functions, knowledge of numbers, visual memory, visual spatial skill, and so on. This is a very important test, and of course, in order to perform the assessment of this test, we also need very specific approach that we have developed. Another test is the test in which we ask the subject to complete to fill a new check according to a specimen. And in this case, we have often observed some difficulties in organizing spatial location about the different information. Also, when we ask for writing some geometrical figures, we have different conditions. In general, subjects with dementia do not recognize the number of angles in a figure, and so we have a very different output. One of the main diffuse tests is when we ask the subject to copy a spiral, and as you can see, there is an example here, but more interesting is when we ask to perform a contour tracing on the shape. And in this case, many subjects, healed person, confirm their difficulty in performing contour tracing activities. And there is a lot of variability in this process. Of course, these are also some tests that we use, in order to estimate the characteristics of a patient. Of course, in order to perform a good assessment, we have to characterize the specific feature of each person, because, as you know, we need a very individual analysis of the person. And this can be performed according to some specific rules and also tools that we have produced. One of these tools is a tool for local stability, and this tool is used to estimate to what extent some variability in the writing is compliant with the specific individual. This is very important in order to detect anomalies with respect to the standard behavior of a person. And as you know, in writing, we can have, or for instance, when we put a signature, for instance, we have two different kinds of variability. A short-term variability that depends, for instance, on the psychological condition of the signer, but also on the writing condition. He can sign with, and it can be a lot of time or no time, and so on. Pen, pencil, and so on. But there is also a long-term variability. The long-term variability is related to the different motor program that the subject has in his brain. For instance, if we look to our signature of 10 years ago, is different from our signature now. And then we have also the modification of the physical writing system, because, for instance, an old person has his arm and his hand that are different from the early age to the old age. So this difference in the writing system lead to a different signature sample. So we have developed some different tools for stability analysis. This is a very simple example. There are thousands of tools, but some example I have time just to show you some typical example. In this case, we can see the signature, and we have realized a simple segmentation strategy that, according to some intersection criteria, help us to extract some local characteristics of the signature. The cosine similarity distance is used to estimate locally if two or more specimens of a signature are similar or not, to what extent they are similar. So we can derive some information about the signature of a specific writer, and we are able to observe some part of the signature in which the writer is very stable. In this part, in this image, for instance, in the green and the blue part denote the stable part of the signature, and some part in which the signature has a very high variability, like the red part as depicted in this image. Another approach that is very similar in the sense that we try to infer some information about the specific characteristics of a signer when he affixes signatures is shown in this slide. And in this slide, we have used a very famous tool in computer vision, that is the tools that we use to estimate the velocity field, the displacement velocity field of in a chain image. So in this case, if we match two signatures, we suppose that one signature is a deformation of another one. And so we try to extract the displacement field between these two images. And if we average the value of the different velocity field, we can obtain an information about, like this, in the right part of the slide, in which you can see the red part that denotes the part of the signature in which the signer is much more variable when he signs his sample, and the other part of the signature in which there is more stability. So in this way, we are able to decompose a signature and to identify some part of the signature that are very stable and other parts that are much more variable. This, of course, is very important, because when you see some variability issue, you have to decide if this issue is pathological or not. And so it's very important to have an idea about the way in which variability is distributed in the signature of a specific signer. Of course, we can use also very standard tools in literature, like, for instance, the delta log normal model that is used in order to study all the movements of human person, some kind of movements, like, for instance, the handwriting when affixed a signature. The delta log normal model gives you an idea of the velocity profile of a stroke in a signature. And so it's very important to understand that if we in the first test, in the preliminary test, can create a model about the delta log normal model of that specific person, then you can use this model in order to verify in the different tests if there is an agreement between a compliance between the different tests and the standard estimation. A more sophisticated and very general tools to estimate stability is based on local correlation analysis. In this case, we have to suppose to have just three signatures, S1, S2, and S3. And we can see some sequence of points of these signatures. Of course, in this case, there are just a few samples for simplicity. And if we match, for instance, S1 with S2 and S1 with S3, we can detect the best matching between these two sequences of samples, of points between the signatures. This can be done, for instance, through dynamic time warping, that, as you know, is a very general approach of dynamic program area. And in this sense, we can observe in detail what say has these couplings. And as you can see, there are some couplings that are very, very secure. Like, for instance, in the first case, in the very left coupling, we have that the point 1 of S1 is directly and unambiguously connected with the point 1 of the signature S2. This means that in this case, the signer has a very standard behavior, a very standard way in starting with his signature. Then you can see the second point, that is the point 2 of the signature S1, that is matched again against two different points of the signature S2. This means that the signer has had some variability, and in fact we have a match that is ambiguous because there is not a direct correspondence between the two signatures. This means that in that specific part of the signature, the signer has a very high variability, because, as you know, you cannot match directly the two samples. So if we give a score according to the type of and the quality of coupling, we can choose, for instance, a rule like this. We can say 1 if the point is directly matched. So the matching is unambiguous. And we can put 0 in the table below if we have points that are ambiguously matched. A value 0 means, in other words, that there is a difficulty in the matching. So this means that between the two specimens of signature, there is some local difference. There is a variability. When we have 1, this means that in the local matching, there is no ambiguity. The signer is very stable in that specific part of the signature. This is a very important point, because if you average the value of these scores over all the signature, we can have the yellow line in the bottom part of the table that give you a stability profile of the signer when he affixes his signature. So according to this value, you can, for instance, detect in a signature what are the parts with high stability and what are the parts with low stability. So you can extract the high stability region of the signature and the low stability region of the signature. For instance, this image is very interesting because, as you can see, in the low stability region, you can find pictorial strokes in which there is generally a very high variability, and also a ligature in which also we have generally we have a very high variability. So this approach gives us a tools to investigate the characteristics of the signature locally. And this can be very useful in order to estimate the behavior, the changing behavior of a subject. One point is very important. As you know, this information about the stability is based on this kind of coupling. But in order to detect this kind of coupling, we can do the same operation, for instance, in the space domain, how far 2 points are, but also in terms of velocity, but also in terms of acceleration or pressure. So we can have a different profile of stability in different representation domain. So in the representation domain of position, of velocity, of acceleration, of pressure, or pen inclination, and so on. So we have a multispectral analysis of stability concerning each signer. And this is very useful because we can use the tool of stability analysis for different operation. For instance, for feature selection, what is the best feature, what is the best representation domain in order to study my signatures. Maybe this representation domain is different from the representation domain useful, the best one, the most profitable of another person. And so it is very useful to use a multispectral analysis of the signature. So stability analysis can be used for feature selection, for region selection, for region-based analysis, for cancelable biometrics, and for assure quality of service. Just a few minutes to discuss about this. Stability analysis. We have that the signatures of a signer can have a different stability parameters depending on the different representation domain. So this information about stability is very useful to understand what is the best representation domain under which a signature should be studied, under which the analysis of a signature should be carried out. Another relevant aspect is that concerning the region selection. It can be possible that, for instance, this person, who is Maria Allegretti, is, for instance, very stable in that 3 parts of her signature. So maybe that our analysis, in order to understand the behavior or the illness of this person, should be related only to that 3 parts of the signature, and not only the global signature, because other parts of the signature are not useful. Cancelable traits. We sometimes do not have all the information, and so it's possible to define some subset of the signature in which we can do the same kind of analysis, but this same kind of analysis can be performed also using different parts, and in each part we can select the most profitable domain of representation. So, for instance, in my signature, or in the signature of Maria Allegretti, it's possible to give a look to the first circle. We have 2 parts of the signature in which the velocity profile is the best one in order to perform the analysis, but there is a 3rd part that is that concerning the letter G, in which maybe the most profitable space of representation for the analysis is the position space of representation. So in this case, we can perform a very detailed analysis, and we can understand before starting the analysis what are the best part, the most valuable, the most useful part of a signature on which our analysis should be devoted, and also what is the best and most profitable space of representation in which the analysis should be carried out. At the end, the quality of service. Here we can see an European signature and a Chinese signature. They are completely different. But our machine, our engine, should give the same quality of service to these very different kind of signatures. And in order to do this, we have to analyze the signature according to strategies like, for instance, those based on the stability analysis tools, and estimate what part of the signature should be considered, how many parts, and what parts should be selected in order to ensure that for 2 very different signature types, we can ensure the same time of performance. We can guarantee the same quality of service. So the experimental results that we have been carried out are so much. Here just we present a very simple results based on deep learning architecture, CNN fundamentals, and we have obtained an accuracy in the definition of healed patient with the dementia that is about 96% at the best. This is a good result, but this is not very important for us, because we know that we need much more patient, a very big, a huge data set, and so on. At the moment, we are interested in investigating more detail these results and this patient, according to some new tools, like for instance, the stability analysis tools that I described to you before. And in general, our future development in my lab should consider a multi-class classification for the prediction of disease stage, and mainly to support early diagnosis, to develop tools for fine writing analysis, like the one I presented to you today, in order also to support the differential diagnosis. And for instance, in this case, the way in which variability emerge can be very useful for performing differential diagnosis, and interoperability among different writing devices in order to also ensure the standard quality of service irrespective with different devices that we can use. Okay, this is the end of the presentation. Thank you very much for your attention.